Hello. Hello.
Hi, Nouridine. Good evening. Or it's good morning to you, I guess, according to your
Yeah.
time zone. Yeah,
Well,
yeah.
not that morning. It's 12 p.m. right now.
Okay, so it's noon, lunchtime.
Yeah, yeah, it's noon. Yeah.
Yeah, okay. Hope you're having a good day, and we'd like to welcome you to our show, which is, as you know, AICorespot Talks, where we feature lightning podcasts with specialists in the industry.
Mhm.
And we have you here as our guest today. And I would like to introduce yourself to our audiences. Like, give us a little background about what you
Well,
do, about what your passions are in the industry, and so on.
yeah, thanks so much for having me. Nordin Bukhari is the founder and CEO of Nytia Labs, a Waterloo-based company developing a data-driving preventive care platform. I would call it the future of preventive care. And we are located in Ontario, Canada. And at Nytia Labs, we use a unique evidence-based practice to change people's well-being metrics into a very meaningful and personalized health recommendations and risks through, well, their biometrics, nutrition, and daily activities data. Um, our goal is to, well, we talk about clinical expertise, evidence, and client-patient caregiver perspectives. We aim at helping corporations take strategic decisions to to support their employees during their employment journey. So yeah, that's Nordin.
Yeah, so that's really interesting to hear, and our viewers are also really thrilled to have you on here. And could you just give me a second while I retrieve the file which I drafted for you, the questions? I'm just opening it. Yeah. Yeah, so I have retrieved the file and we can begin with our podcast proper.
All right.
So, yeah. So we're really thrilled to go, and we're once again, really happy and thrilled to have you on the show. And I'm sure our audience is too. So the first question that we have for you is, could you explain to us data-driven paradigm shift within healthcare in layman's terms? What is the extent of data's predictive and preventive power within healthcare?
Yeah, well, what I would say is before 2012, we were still very limited in AI algorithms capabilities to solve complex problems, right? And yeah, thanks to the likes of Geoffrey Hinton from the University of Toronto and Google Brain, thanks to Benjio Joshua from University of Montreal and scientific director of MILA, the Quebec Institute of AI, and also thanks to Ian LeCun, the leading who is leading the Facebook AI research. And yeah, all of them, they won the 2018 Turing Award, often referred to as a Nobel Prize of Computing. And of course, such algorithms need a lot of data. So those researchers, they pushed further the boundaries of AI to powerful algorithms such as deep learning. And as I've stated before, they won, because of that, the Turing Award. And of course, those algorithms of deep learning need a lot of data and more computing power, right? And thanks to the likes of companies like NVIDIA, who currently designs NVIDIA RTX, the most advanced platform for AI technologies that are revolutionizing the way we create and process our data. So I would say from customer service, call logs, and clinical documentation to satisfaction surveys, patient-generated health data from the Internet of Things, such as wearables and remote patient monitoring stuff. Providers of every size and specialty have fully accepted the notion that no scrap of information will go to waste, right? So in the era of machine learning, AI, and semantic data lakes, they decided to, to take advantage of all of these data. So, well, it's still very hard to collect a huge amount of data, of image data, for example, because as you might know, we can say that billions of people are suffering from cancer or something like that. So it's still very hard to collect such images. So because of that, it's not easy to benefit from such algorithms requiring a huge amount of data for better outcomes. But however, a lot of researches were being conducted in these areas now, and nowadays we can think about running such algorithms on a small amount of data. Recently, I was in discussion with a master's degree research student, and that was exactly what he was working on. So we were discussing, he was trying to find some patterns on images, but the thing is, the challenge is there is no enough data, right? So they need to find techniques to develop new methods to be able to run deep learning algorithms and stuff like that on a small amount of data. It's still a challenge, but a lot of researches have already been done, and IBM looks to be a leader in that.
Industry experts have spoken about the power of data and the importance of data and how important it is to everything. And you seem to concur with that sentiment, that data is kind of king.
Absolutely.
Yeah. So moving on to our next question. So decision-making is obviously a huge part of business. How does AI-driven decision-making, technologies like AI and ML, which are used in the pursuit of decision-making to help decision-making, how does that kind of up the ante, or kind of how does that give us a better chance at reducing operational costs, integrating AI and ML into that process?
Well, if we see all these all the industries that being interested into AI capabilities, it's for sure because of the way it's helped them reducing their operational cost and many other advantages. So as I've stated before, with such amount of data, we're able to collect from the healthcare industry, instead of simply presenting information about the past event to a user, for example, predictive analytics estimate the likelihood of a future outcome based on patterns in the historical data. So nowadays, they don't just have a record of historical data. They would like to take advantage of it, right? And this allows clinicians, financial experts, and administrative staff to receive alerts about potential events before they happen, and therefore make more informed choices about how to proceed with a decision, right? So the importance of being one step ahead of event is more clearly seen in the realms of intensive care, surgery, or emergency care. In those areas, for example, a patient life might depend on a quick reaction time and a finely tuned sense of when something is going wrong. So you don't, because of the quality, the data we've been, the historical data, for example, we're able to take quick actions about something going wrong. And one of the best examples we could look into is the COVID-19 pandemic, right? And we all agree that government worldwide would have spent more money without the power of AI, right? I don't know, where do you guys live? India or?
Yeah, we're in the south of India. We're in Chennai, basically. And
Okay,
Coimbatore, some of our colleagues are in Bangalore. We're all over India, basically.
okay. Yeah, so I guess it was the same thing. So without the power of data, they will have spent more money. And researchers have been able to quickly collect data, process it, and monitor the disease propagation, right? And that was, and still is, the backbone of all the decisions made and being made by our government to efficiently handle the pandemic. And another example, for example, is our company, Nytia Labs. What we're trying to achieve is, uh, let's say, well, it's a fact, right? In North America, for example, governments spent between 75 to 80% of the total healthcare investment into fighting chronic conditions. With appropriate data driving preventive care solutions, that cost could be heavily reduced and used for other things, such as rare diseases, for example. And that's exactly what we're trying to achieve at Nytia Labs. We're trying to use patient data, well, users data. Uh, we're trying to compute their well-being metrics through this data and convert it into meaningful and personalized recommendations and health risks. Then we could expect to prevent chronic conditions, not only preventing them, but for those who already sick, we will be able to help them manage their conditions efficiently and avoid them to fall into a new disease, a new chronic conditions. Because if you already have a chronic condition, you have high chance. There is high chance that you fall into another condition if you don't take care efficiently. You don't manage efficiently your current condition. So yeah, those examples, for example, give us insight about how the healthcare costs could be reduced, for example.
That's a very informative response, and I'm sure that's a lot of learning for our audiences. And you mentioned a really interesting point, which kind of leads into our next question. You mentioned that illness, treatment of an illness, it's like being proactive. It's like being there like as it happens, catching it as it happens, like not letting it get to a level where it's kind of there's nothing we can do, but instead catching it at that stage where it can be fixed. Wearables are a kind of really big trend in the industry right now. And would you say that previously we spoke about the data-driven approach and how data is the king and how data is the backbone of everything? And yeah, absolutely. And with keeping that in mind, would you say that wearable technology, the data contributed by wearable technology, which is it's on a 24/7 basis because the patient is always wearing it, in patient monitoring and in patient management, doctors, for practitioners, is it kind of is it kind of a facilitator? In other words, like this, like the data-driven, kind of data-driven, or the variables rather, the variables. How do they facilitate this data-driven and patient-centric approach? So we can, for example, I'll give you an example. The patient is wearing a wearable and is being monitored, and the condition is through their vitals or whatever, they're able to find out that there's a problem like on the spot, and then they're immediately able to treat it. That's an example. Like how, like what positive impact is wearables having on that kind of patient management?
Well, wearable technology nowadays are an important data source that is empowering strategic decisions. And we can see it everywhere, right? But specifically in the healthcare industry, it's a critical data source. These wearables, for example, can track the user's location through the global positioning system. They can track vital signals such as heart rates, burn calories, steps, speed and time, monitor sport activities, for example. They also can track your sleep patterns, and that is critical for your health. Your sleep patterns are really critical. A lot of applications are being developed around just on sleep patterns, or even your diet behavior, what you're eating, your nutrition. They can also, we can also, well, those wearables also using accelerators, gyroscopes, heart rate sensors, galvanic skin response sensors, and can notify users when they achieve activity goals, right? At Nytia Labs, for example, a mobile application, Wellbeing Plus, use this data, as I've stated before, for our well-being metrics computation. So we collect the biometrics data from the user. Biometric data such as your heart rate and all those things. We also collect your sleep. And through all those informations, we're able to compute your well-being metrics. So the outcomes, how we use the outcomes, we use it, and based on our powerful recommendation system and evidence-based practice, we're able to shoot to you a personalized health risk and recommendations. So that's an example of how those wearables are facilitating a data-driven patient-centric approach. Another example is, for example, I'm pretty sure you're aware about the glucose measurements from some wearables, right? So doctors, physicians are able to monitor your, if let's say you're suffering from type 2 diabetes, for example, they could monitor remotely changes on your glucose measurement without the patient being forced to go to meet you at your hospital. We also have wearable technology that could monitor remote patient behaviors in order to take appropriate decisions without the patient, as I've said, being forced to physically be in the healthcare with the healthcare specialist. And that is, we can spend the whole day coming up with a lot of examples around the wearables. Just to summarize is, what I could say by in summary is, we are at the era of wearable technologies, data source collection, data collection.
That was really informative. And again, one of the things that you've mentioned kind of ties perfectly into the next question that we have for you. We're talking about a data-driven and AI-driven approach to healthcare, which is kind of enabled by these wearable technologies. So obviously, there's going to be a massive amount of data that is being handled, of patients' private data that's being handled in healthcare enterprises. So how does privacy change? Like, what steps should be taken to ensure privacy, to ensure that patient's personally identifiable health information doesn't fall into the wrong hands or isn't abused, or it's safe. It has to be safe, right? They owe that to the patients. They're obligated to maintain the patient's privacy. When you're handling such massive amounts of data, and you also have the power of other technologies to achieve that privacy, how does that process go?
Yeah, that's a huge point there, and that's a very concerning question nowadays. Looking at the data we're collecting for our models to be processed, there is a lot of sensitive information we're processing, right? Because I would say by using our users or patients, by collecting the data from their wearables and stuff like that, we're sharing them with their physicians. That's one thing. And why cybersecurity is in healthcare is so important, because patients' data include personal identifiable information such as names, date of birth, addresses, bank accounts, and numbers, and medical information specifically, such as ailments, disabilities, abuse, mental conditions, and any other conditions, right? A data leak can damage the reputation of both the doctors and the patients. That's something to consider. And because of that, there is a lot of regulation being discussed in North America, in Europe, in Asia. I don't know, in India. I have some information about India, of course, but not in depth. In North America, for example, North America alone, we have the US law and we have Canadian law. Though health app technologies are being deployed faster, the laws catch up, because you can't just take people's data and do whatever you want with it, because you will get fined. In US, for example, we have HIPAA, the Health Insurance Portability and Accountability Act, abbreviated as HIPAA, and that law passed in 1996 guarantees healthcare privacy specifically. Since its adoption, HIPAA has been modified twice because there is a lot of concern going on, and lawyers always come up with new issues after old issues are fixed. They will come up with new issues, and it keeps going on, right? And HIPAA protection applies to anyone wanting to create a health-related application for the US market. So, as in our case, for example, we would like to deploy in US, so we need to be HIPAA compliant. Otherwise, you will get fined. Well, if there is a violation in your product, you will get fined. And we're talking about up to 50K. And in the case of willful negligence, for example, fines can be up to 1.5 million per violation. So that's huge, right? And of course, not all the health-related apps must follow HIPAA regulations. However, large platform like Google Fit, for example, you know Google Fit, right? Google Fit, Health Kits must comply because they allow users to share personal data with their physicians. If you're developing a calorie counter, for example, though, HIPAA compliance is not a must because you share nothing with your physician. And there are actually 6 steps to make your medical app HIPAA compliant. The first one is the use of two-factor authentication to secure your user accounts. You need to encrypt your personal medical data at 2 points in time: when the data is collected on the device and when it's transferred to the server, so that if a hacker, for example, is able to intercept the data between the 2 points, the data collected will be useless because he can't break the algorithms used to encrypt it. The third step is to add a feature that automatically logs off users after a certain period of inactivity. The fourth period incorporates a wipe feature to erase personal data from a device before the data can be stolen or misused, right? We also have to ensure that the regular app testing, and updates. You need to regularly update your app because we always have loopholes in the app. You'll once your app is on the market, you will start getting loopholes. You fix it, you will have new loopholes. It's always been like that for all applications on the market, all software-related product on the market. And the sixth one is to offer automatic data restoration if a device is lost. So these are the 6 steps for HIPAA. I know better US and Canadian regulations because I live in Canada, of course, and we're very close to US. As for Canada, for example, we have HIPAA. So the Personal Information Protection and Electronic Documents Act, HIPAA. It came into effect in Canada in 2000, right? And under that law, entrepreneurs are responsible for gathering, processing, and disclosing personal records, including those collected via an app. And HIPAA defines personal data to include general information like names. We didn't say it with HIPAA. So like names, identification numbers, and credit and medical records. It's a little bit similar to GDPR, the European Union law, but it's much broader than HIPAA. So Canadian law has more features than HIPAA. And to adhere to this law, you must hire a person responsible for HIPAA compliance. So that means that you will need to run on a audits on a regular basis to make sure that all your environment, your work environments are compliant. The way you process the information, everything. You need to specify the reasons for collecting and processing user data. You need to notify users about the type of data collected. You need to inform your users about how this data is processed. So you need to, for example, let's say you use a couple of machine learning models, for example, you will need to your models to be explainable. You will need to have them trustable. So let's say something happened after it's on market, you will need to explain how each step leading to the results is processed, how your data is processing, is being processed. So it shouldn't be a black box processing. You should be able to explain it, and it should be trustable, right? So you need to get user consent for the data collection and processing. They need to agree that you will collect their data and process it. So in our case, for example, we have a dashboard at Nytia Labs. We have a dashboard, and that dashboard is for corporations, because our business is a B2B business, right? So corporations will use our application as a benefit for their employees. So each employee should have to give his or her consent for the management team to use their data for a better insights. If I'm an employee, for example, and we have such a platform as benefits, I will need to say, yes, I agree that the management team will collect my data for better insights and a better support to the employees. So that's number 5. Number 6, the stock collected data for a reasonable period. You should be keep collecting the data and stuff like that. So you should delete data when it's no longer needed. You should protect data. You should provide users with access to their data upon request. So these are the steps to adhere to HIPAA, the Canadian law. The EU law looks similar to the Canadian law, and as I said, it's a little bit broader and a bit close to the HIPAA, which is the US law. In Asia, for example, they follow what is known as well, it's also close to the GDPR, the European Union law. But each country, Australia, for example, India, South Korea, China, Taiwan, has its specific acts. India, for example, has a Digital Information Security in Healthcare Acts. And China, for example, has Cybersecurity law. Taiwan, for example, they have Personal Data Protection Act. So it's something like that. But in all and for all, there are 4 must-have measures for privacy and security in healthcare. The number 1, 2-factor authentication. So you should have 2-factor authentication. You should have SSL technology. You should have, for the security between an app and the server, you should have a data wrapping technology, as I've explained it before. And finally, you should have app testing and update technology. I've discussed about it before when I was talking about the loopholes. So I think These are the must-have.
Was a really packed response, and we got a lot from that, a lot of info from that. And I agree with you. Privacy is really important, and it's not given the priority that it deserves, I feel, because the health information of a patient, it's their truth, it's their dignity, it's everything they are. It's when that is compromised, that's not a good thing. I mean, you've got issues like people posting personally identifiable information, maybe even health information online on the dark web. Now that you have the dark web, that's not something that should be happening. So we
absolutely. And nowadays, and nowadays it's not a nice to have, but it's a must have in healthcare specifically.
Absolutely. It's a very pressing need, and it does really deserve a lot of importance. Moving on to our final question before we wrap up things for the day. We spoke a lot about data science and AI, how data is the backbone of everything, and if we're working AI algorithms or ML algorithms, we need the data for it to be really effective. So what difference what difference are these technologies making in the domain of drug discovery? How are they helping the discovery of new drugs? For instance, I'm sure a lot of these emergent technologies have been used in the pandemic times for the COVID-19 pandemic. I'm sure they've been used to crunch the data. I'm sure they've been used to kind of come up with a lot of permutation combinations to see what might work with the vaccine, what might not work with the vaccine, what's happening, and so on. So many things that they could do in this kind of a pandemic situation. So in drug discovery, how are they changing the game?
Yeah, that's another area of where AI and machine learning is being praised a lot, because well, through drug discovery, new candidates, medications are discovered, right? And historically, drugs were discovered by identifying the active ingredients from traditional remedies, right? And drug discovery is used to be costly and time-consuming, right? The starting phase, for example, of research and development in the drug discovery process lasts up to 6 years. And you can start up with 10K candidate, for example, 10K tested candidate, and end up with just 10. And at the end of the day, just one will be approved for the use in patients by regulators. So that's something very I don't know I can't find the right word to express it. So it's not a joke. It's really time consuming. And that's one of the area I will say deep learning specifically and machine learning algorithms will have a huge impact on. Because the scientific progress nowadays is data driven. There is a huge amount of data to be processed. And for example, big data, for example, the poses challenges for data scientists, and as indicated by a new report, I think it's a report from IBM, Institute for Business Value. 84% of life science companies benefit from structured and unstructured data. And researchers do not keep up with professional articles, patients, and other unstructured data referring to their respective fields. And unstructured data are really complex to be processed. Therefore, they leave out of consideration other scientific discoveries that can enhance or supplement their own research results, right? And almost 80% of medical data remains unstructured. That means there will be more complexity because unstructured data are already complex to be processed, right? And medical data remains unstructured and untapped after being created. So that's why most medical advances are not achieved in isolation. So it's recommended to combine knowledge from different organizations and research fields. AI can investigate large amounts of data sets and has relentless capabilities to coordinate and match data. Because as I've stated at the beginning, deep learning requires a huge amount of data for the models to generalize for the better outcomes. And that's exactly the point here. In this drug discovery, we have a huge amount of data and that are not used. So using those techniques, those algorithms, we can accelerate the drug processing steps, all of the steps, not just one. So every phase of drug discovery process procedures, we can use all these algorithms to accelerate stuff. And many computer-oriented strategies and other methods were used to invent and optimize, for example, lead compounds, along with molecular docking, pharmacophore modeling, selection forest, and comparing molecular disciplines analysis. And machine learning and deep learning have come to be appealing techniques for drug discovery. And the utilization of algorithms of machine learning and deep learning in drug discovery aren't attached to a specific step as I stated. They can be used at any stage of this lengthy process. So nowadays, we can firmly state that machine learning is becoming an essential technology for drug discovery and development, because AI platform architectures can process vast amount of data, which help researchers in the discovery and development of drugs by providing them with valuable, very valuable insights. So I'm not deeply in the domain, but that's what I can say about it. It's a very interesting domain, and the researches and work being done in it using AI technologies are amazing. That's amazing.
Of AI and ML and other deep learning and other such technologies, emergent technologies, is if you see other incidents in history like this, if you look at the Black Plague, or if you look at smallpox, for instance, it took so long for an effective vaccine to come out. It took so long, so many years, so many years. But
just look at what's happened in the case of COVID-19. That's why people were reluctant at having the vaccines, because it was designed so fast. Because we didn't used to see vaccines to come up so quickly. That's why we really suffer at the beginning. So because of the AI and other stuff, Pfizer, for example, they had how do you call it, a partnership with the the IBM Watson. IBM Watson is a technology of IBM, and IBM Watson helped them a lot in their vaccine producing process. So we see it clearly. It was pretty quick. Most of the time, it will take 6 years. And let's say we had to wait for 6 years for the COVID-19 vaccine to come out. We will all die. We will all die, right?
Like something from a zombie movie, probably. If we were to wait for 6 years, it really is a boon that we have these technologies that can quicken the kind of release of effective vaccines, and it's really something else. It's like we cannot downplay the importance and value of what we've achieved in that regard.
Absolutely.
Yeah. So that brings us to the end of this session, the end of this episode of AICorespot Talks, and it was really great to have you here. And we hope to have you here again, like hopefully in the future, maybe some other episode that you might be willing to do, something else that you might be willing to talk about. Really hope to have you on the show again. Before we sign off, is there anything that you'd like to share with our audience? Anything that you'd like to say? Anything that you would like to kind of highlight or mention, or kind of a parting message for our audiences?
Yeah, I will have 2 things to say. The first one is stay tuned with the work we're doing at Nytia Labs. We're really trying to come up with very useful solutions to help governments, corporations, and individuals to have a better life, healthier and happier. The second one, I will say, no matter what you're studying nowadays, you need to have one foot into data industry. You need to know how data are being processed, because very soon it is not if it's not there yet, very soon all the areas, including wood sciences, mechanical sciences, all these sciences will have to start taking advantage of the benefits of data science, AI, and big data. So I will encourage young people, all the students, to start being interested by data science and stuff like that.
That was a really great episode, I felt. And once again, it was a pleasure to have you on here on the show. And we hope to see you here again in the future. And that's all we have today for this episode of AICorespot Talks. That was Nouridine talking to us about the importance of AI and ML in the health space, and how the power of data and how the power of machine learning and AI is facilitating drug discovery, how privacy is being maintained with the power of AI and ML, and a lot of other things, and a lot of important things for the healthcare industry, I feel. So that's all for the day today. We're signing off. Thank you once again, Nouridine. Thanks a lot for coming on here.
Thanks for having me. Bye.
Thank you. Bye.